Hi everyone, going to give some feedback on the last recruitment pool interview questions for our Queensland Ambulance Service fellows. People want to understand what we look for in candidates during the recruitment process. This is for the candidates who have actually been selected after providing their applications to us. We obviously can't interview everyone. We interview as many people as possible, but inevitably about 50 to 60% of people don't make it to interview. For those who did, we asked 4 questions, and we're trying to actually understand what makes you tick. So the first question was, what are the positive and negative traits of specialists or consultants that you've worked for, what they meant to you? We didn't want to know the individuals, obviously, but we wanted to know what really you valued in your specialist colleagues or your mentors. And once people provided that sort of list, then when asked them, what superpower are you going to bring to the QAS? We're trying to understand what you'll bring us. Now we know what we'll give you. We'll give you this fantastic exposure to critical care resuscitation at a volume that you probably haven't seen before in such a short period of time, and access to different systems. But we want to know what you're going to bring to us. We're looking for something unique. It didn't mean you had to split the atom. It just had to be something that you were confident that you could bring to us. So the second question we asked, obviously lived experience is really important to us at the Queensland Ambulance Service. We really care about what our patients think about their care, what they want from a service. It's often different to what treating clinicians think. And so the second question concentrated on this. We talked about the accreditation requirements for the Queensland Ambulance Service, and especially what patient experience meant for us. We wanted to understand what the clinicians who are applying to work with us thought about lived experience and what examples they could provide. We were looking for someone who was very patient-centric in their thinking, who was a strong patient advocate, who wanted excellence in clinical care, and who wanted to listen to what our patients wanted and merge the two things together. The third question was about conflict resolution, but it was put to the candidate that one of your senior clinicians or your mentors had instructed you to do an invasive procedure that was not evidence-based and you thought would harm the patient. What would you do? How would you handle that situation? In fact, I developed this question based on an experience I had as a quite junior registrar, where someone asked me to do something and I declined to do it because I didn't think it was evidence-based and I thought it could potentially give patient harm. We wanted someone to make their decision. And ideally, the decision was to take into account and do greater assertiveness, and everyone does that, we all know that, but we wanted you to make a decision on how you were going to deal with it, because that also told us what it meant inside you and what type of person you were. So that was an important one. And so everyone got through that part of the question. Then we flipped it on its head. We said, oh, that's very good, giving us that answer. But now the junior clinician that you've asked to do something says they're not doing it. How are you going to handle that? So we wanted to actually see if people were playing us or actually what they truly believed. And how they answered both parts of that question was quite intriguing and told us a lot about the candidate. Now the fourth question was a quasi-clinical question. Essentially, we gave a situation where a resuscitative hysterotomy could be considered. Now, in my view, it actually wasn't required in this scenario, given some of the time periods involved. But we wanted the candidates to make a decision one way or the other. We did not want you to hedge your bets. Oh, I could ask other people, I could make a phone call. We wanted people to actually make a reasoned decision. Personally, I didn't care which way they went, to be quite honest. I thought there were pros and cons for both decisions. In the case that I was involved with, I decided not to do it in that particular situation. So we wanted people to actually make a decision and understand it. The second part of the question was how to deliver news that you were stopping resuscitation on a patient. And in fact, we went straight into a role play where the candidate had to speak to one of the interviewers present as if they were a relative and deliver the news that we were ceasing resuscitation. And that told us a lot about the candidates. We could tell people who'd done this before, who knew what was required, who had underlying empathy and understood what it's like to lose a loved one and how to deliver that message in a very compassionate way and to embrace what was a really difficult scenario. So overall, these questions aren't really about how you treat heart failure, how you're going to treat someone with an extradural hematoma, how you're going to do a rapid sequence induction. They're a short period of time for you to show us what you're worth, what makes you tick. And so it's really important during that period of time you hit the mark. We don't want people who are overconfident. We don't want people who are underconfident. We want you right in the middle. Now that's hard to get to, but if you actually have firm belief and have had enough experience, you will show your wares during this period of time. We want kind, empathetic, competent clinicians to come to us at QAS. Because if we have those three qualities, you are really going to fit in, and you're going to be an exemplar for all the other clinicians that you're working with, because that is what makes us tick. That is how we achieve stellar outcomes for our patients.